First, let me tell you that we heard a lot today about this issue of protecting privacy and a lot of suggestions about how we might maximize the release of data while minimizing the risk of re-identification of subjects. I try to make a list of the topics, the subjects of the discussion today that came up on that topic. I'm not expert on it at all, but I got quite confused, and it seemed to me that there were a number of models suggested. It might be nice to kind of try to get those together to see if there's some systematic way to look at all of those opportunities. I was going to talk a little bit about my own experience with data. As a consultant, I've spent a lot of time with industrial organizations in that capacity, not just industry, but a lot of time with them. I do not speak for them in any way at all, and the experience is quite mixed. Industry, to me, is not one thing, it's many, many things, and companies have quite different attitudes about all of the subjects we're talking about here today. We do a lot of work with toxicology studies and other kinds of experimental studies, and also, not I, but others in the firm, a lot of work on epidemiology studies and other studies related to environmental health. We generally, in our work, rely upon published studies. We do not go behind the studies. We do not seek to go behind the studies. The only occasion when that happens is if we're doing something for a company that's going to submit something to a regulatory agency and where they have to submit all the raw data. There are those kinds of requirements, and we do the double check on that kind of underlying data. But generally, our policy has been to rely on published studies, not uncritically, because we think you can analyze what's published, what the authors have said, and go back and look again at the basis for their conclusions to see if it stands up. Occasionally, we just don't understand material we see in a lot of published studies, and we just call the authors. That works. It works 95% of the time. People are glad to yeah, we have that information, glad to share it. So we've not had any particular difficulty in that area. There are clients who now come to us when studies appear which seem to have a strong potential to adversely affect their business interests. And the ones of most concern with industry, in my experience, are those emerging from human studies where authors are looking at causal relationships between some exposure and a disease. And industry gets real nervous when studies like that appear, if it's their product, because I think regulation is one concern, other kinds of costs, but the concern about, in this country, product liability and toxic tort litigation is very, very high. And when something gets elevated to a known human something, litigation breaks out all over. I mean, that is the experience of most companies. So you might understand that, have at least some understanding of why they might be concerned about such a finding. I find companies have different attitudes about what they want to do in those circumstances. I discuss a lot of possibilities with them, including doing additional studies. I have heard from some companies that they want to find a way to undermine a study, and I just say, go away. I will not engage in that kind of activity. My attitude has been that, you know, you have to identify, to go after the underlying data, to seek it in some way. You should have a good scientific reason. There's something about the study that raises a serious, significant question. You ought to be able to reveal the identities of the experts you will call to look at the data and reveal that to the source of the data. And the toughest problem, that's not hard to do, but the toughest problem is finding some way to conduct that analysis in an independent, truly scientifically independent way. And that's very hard for industry to do. I'm paid by industry for my work. I think Linda said, I have an automatic conflict of interest when I do that. So how do you avoid that? There seems to be no mechanism other than something like HEI. And I also agree with what Dan Greenbaum said. There has to be some civil way to do this. I've not seen it yet. I've witnessed these very adversarial confrontations, and they're very difficult to even watch. I certainly don't want to get involved in them. I don't think I have. We have made freedom of information requests in my 30 years in consulting for underlying data 2 times. In one case, we verified what the original analysis showed. In the other case, we could not get enough data to do any real work. It was a real struggle. So I kind of avoid this issue of reanalysis in my own practice, not completely, but certainly with respect to research data. But let me say, I was trained for 15 years before I became a consultant at FDA. And at FDA, I was taught that reanalysis, and I think I'm using the term right, Lynn, is important. That we would not simply accept a summary report from an industrial company seeking some approval for a food additive or a drug or other ingredient without the underlying data. And that practice still goes on. And when I spent a couple of years of my career there looking at studies, looking at raw data in this way, and it's very tedious, but over and over again you would find errors, sometimes maybe to the benefit of the company, sometimes not. You would find misinterpretation of the data. It happened all the time when you looked at the underlying data. And then, so I get taught that it's important not to simply trust what some other person's summary has said. So given what I said before, that I don't ordinarily engage in that kind of practice, because I think it's in my current work, it's very, very hard to get underlying data. So we try to use the data that's published. One of the things that was found by one of my colleagues in that FDA, in those FDA years, was that there were a couple of studies, more than a couple, submitted where there was clear evidence of fraud in the data submitted. That led to what are called, I think somebody brought them up earlier, good laboratory practice regulations for animal toxicology studies. I think they are very, very important. They have gone along, they're still in effect. They're in effect all over the world. They've gone a long way to improving the quality of the data, and the way, there's a lot of emphasis on data management in that practice, and presentation of the data in a way which all the underlying data sort of come out when the study's produced. It's all there. The best example in my mind of this is the NTP, which Dr. Birnbaum directs. They do a lot of animal studies themselves on chemicals not supported by industry, or where you can't find an industrial sponsor for a study. They produce all the data as the study is produced. You can find every animal body weight you want. It's a very transparent and excellent data sharing source. I think it's a model for this kind of thing. A couple final points. GLP does not apply to research studies, research toxicology studies. There are a lot of them. Often they are not done for purposes of supporting, at least weren't initiated to support regulation or other use by government agencies, but a lot of them end up, after they're published, on the desks of reviewers at EPA or other agencies. And there's no GLP requirement there. If you follow the debate on BPA, which has been going on for many years now, there's if it wasn't GLP, you can't use it, versus the other side of the coin, that you ought to look at the study for what it's worth. And so the GLP becomes a very, very important component here. I think there ought to be some effort to see if we can not impose GLP on research. I think there are a lot of reasons not to do that. But I'll make a conclusion here at the end on some point I would like to make on maybe improving that process a bit. Epidemiology studies, of course, it doesn't apply also. There's no GLP or any similar requirement. I think there would be some advantage in beginning to think about government agencies that are sponsoring research on environmental matters, whether it's epidemiology work or other experimental work, to begin putting together some guidelines on best practices for starting, and I think Dr. Howard mentioned it, and maybe some others, that you ought to be building into the sort of initial planning stages for any such studies the notion that it's all going to be shared. And what is it you need to do to make sure it is available in the, for example, in the way the NTP data are available when the study is finally produced. I think some guidelines are probably needed on that, not regulations, but at least give some folks an idea of how they ought to be organizing their data management process so that at the end they've got something ready to go when it's needed. So that's my final suggestion. I would point, I got that idea, my final 10 seconds. One of my colleagues who works in an ecosystems work at the company pointed out a very interesting document from the Oak Ridge National Laboratory, Best Practices for Preparing Environmental Data Sets to Share and Archive. It's a big document that goes into exquisite detail on what investigators should be doing to prepare to, publicly release the data as they develop it, and it's excellent guidance, I think. So that's something just to perhaps to discuss in connection with federal funded work. Thank you.
Thank you, Joe. Ellen.